Walking Stick Library presents Morgellons with your librarian hostess with the mostest, Eileen Kramer. And remember, you can catch this stream live on Twitch. And we're going to hear some of what he has to say. And yes, we're about halfway through the show, but that doesn't matter. Let's go.
These fibers are being pulled out of people's skin, and
I'm going to move us back to about 44 minutes. I want to get him at the beginning because he's going to talk about something called Morgellons. And that was he says Morgellons, I say Morgellons. I probably am not saying
We're trying
it.
to think about protecting other people in the future from having the same thing happen to them.
yeah,
You know,
100%.
Okay, I'm going to move him back just a little further, probably about to the 40-minute mark. Let's see what happens here.
of the event that's concerned because he was, CC'd in the emails, and maybe he has the most to lose. Having people find out about what really happened and didn't happen that was supposed to happen. I mean, it's ridiculous the amount of money that was taken, and then she and Tavon just got miserably depressed. Okay, so it's something that let the
Hope. But
I'm going to move us up to about here.
remember,
Let's see.
listening to him, I think on Coast to Coast, there were so many radio shows that he would come on. Maybe it was Jeff Rentz, but I had so much respect for him and the research, and my eyes were being really opened up to the realm of biological warfare in those types of broadcasts, Doug. And I don't necessarily hear that much about Morgellons anymore, and yet we know these fibers.
Okay, I'm going to put us back at the 44-minute mark and hope that we pick him up at this
100%,
point.
yeah, 100%. All right. Well, I appreciate the
so
candor today, and I'm really sorry that happened to you, Hope. But I know you're tough, and I know that justice is best left to God. And I think that's true for everything that we're facing as humanity, too. But I want to see justice in this lifetime again, like that rant I played earlier of the woman in her car, so distraught by a system that has long since thrown us all under the bus, including people like Doug, who suffered from Morgellons. Clifford Carnicom was really the leader in this space in research, and I remember listening to him, I think on Coast to Coast. There were so many radio shows that he would come on. Maybe it was Jeff Rentz, but I had so much respect for him and the research, and my eyes were being really opened up to the realm of biological warfare in those types of broadcasts, Doug. And I don't necessarily hear that much about Morgellons anymore, and yet we know these fibers are being pulled out of people's skin, and people like FM8 are finding fibers now in the rain that seem to be like alive. The stuff Mike Adams is finding, the stuff that we think is in chemtrails, and then that's not even to speak about what's being found in the blood of those who have been vaxxed. So where would you like to begin this part of the conversation, Doug? In 2025, how do you frame up Morgellons disease in a world where we're all polluted? I mean, I just don't even know. I wonder how many microplastics I have floating around in my bloodstream.
well, Sean, what I want to start off by saying is that this is the first time that I'm coming forward to talk about this very personal subject for me and my health and the demise of my health. I did speak about it on a program with Hope and Tavon, but um, you know, this is something that I wanted to get into in more depth with you. And unfortunately, I don't think we're going to have the time today, but I'm more than glad to come back for another episode if you want, because I have enough knowledge now that I can break things down to help the audience wrap their head around this. And I just want to also start by saying, look, what has me motivated to come forward now is this very simple quote: the only thing necessary for the triumph of evil is that good men do nothing. And I cannot, as what I'd like to be, a good man, do nothing. I can't just go any further being idle about what I've come to know that the world just does not know. Unless you were in the shoes that I'm in, having this happen to them, you wouldn't know, and they are hiding it from everyone.
I'm gonna hold here because Morgellons was one of my favorite walkthrough research topics for years. It still is. When I heard Morgellons, I was like, and I don't know if it's Morgellons or Morgellons or Morgellon. They say Morgellon in France. I don't know, I'd forgotten about it, and then this pops up and like, wow, this is gonna be fun. So let's go.
And so, what I want to get into, with what time we have left, is very simply this: if you go to a doctor or any medical practitioner, you ask them, "Do you know what Morgellons is?" Almost every one of them will say, "No." What's Morgellons? And I had a doctor I once went to, and I said, don't put this on my medical record. I don't really want it on my medical record because I know there's back doors to all that, and then you get categorized and this and that. And at that point in time, I cared. Now I don't care in a way. I don't care anymore because the truth has to be known. So,
Okay. What would probably go on the medical record if it did have an IDC code would be on the medical record would be psychiatric visit or dermatological visit. We can look that up if you want to hold for just a second. I'm going to make some space here if it will let me. Now, Miro's been acting terrible lately. I don't know if you all notice it, but Miro has not been acting good. Let's get some space on the Miro board. What is your problem, Miro? This is at their end because everything's working on my end. Okay, come on, respond. And what we would be looking for, very quick search. Most of these are very quick. This one is super quick if it ever lets me in. That's not the right size. Try that again, folks. That's the right size. 1, 2, and I'm not sure if it's an IDC code or a Medicare code. There's a medical code out. There are medical codes out there. Hello, we know we don't want that. We want this. We want the color. We want this at 36. Medical code. MR. There, that's all I want, and I want an and. I don't think there is a medical code for this, for a lot of reasons. Because it is considered a psychiatric, to have a big psychiatric dimension. That's not a dirty word around here. I go to a shrink. I love my shrink to pieces. I have a very nice shrink. Psychiatrists, psychologists, OTs are doing the work of the Lord. The other doctors, yes, the surgeon did a great job. The anesthesiologist did a fantastic job, but you feel like a piece of meat. When you go to the shrink, you don't. And when you go to the OT, you're a human being again. So we're back here. And chances are very good there is no medical code for this. Let me get Google up and we'll take a very quick look. Go find it. That's okay if there aren't. That's probably what I want, ICD-10. Okay. The International Classification of Diseases does not have a specific code for Morgellons. So you would be seen for something else. How about a Medicare code? Or a billing code? Okay. Does it look like there's a billing code for this? So again, you wouldn't have to worry all that much.
What it is that they run to the computer and they Google the name and they end up.
What? I don't think they do that. I think they pick up the Merck manual. They're good doctors. They're going to pick up the Merck manual. They're going to go one step up. They might even go into Medline. PubMed if they have a subscription. Medline if they have a subscription. PubMed if they don't. And while we're at it, if you're being seen for something psychiatric, frequently they don't put a diagnosis at all on your billing code. They'll simply say office visit. There's a lot of confidentiality involved in medical records. And I know this because I'm a little concerned, and I used to pay for my shrink visits in cash. Exactly because I didn't want the credit people seeing it. So I understand where this guy is coming from, but I also understand he didn't have to worry.
Up on Wikipedia. Now, Wikipedia still has a page that tells the world that this is delusional parasitosis, which means you're having a delusion that you're having parasites crawl on you under your skin and above your skin. And well, that's exactly what's happening. And they don't want people to know that. And I don't think you can classify this necessarily as parasites because these are other types of organisms that are synthetic biology. So it's not regular type of parasites. So if you have the keys to alter that page, within 30 minutes, it will revert back to the way it was. Now, that right there tells you that Wikipedia is corrupt and they mix the truth and abundance of truth with lies to have the public believe a certain way. This, sort of social conditioning, selective programming, whatever you want to call it. Okay. So the thing is this I, for a long time, would look at the sky and realize, hey, there's something going on there. For many years, I said, this is not good. It cannot be good for us. So after a certain point in time, I said, I got to get away from this. So somehow I decided to break away and I took a long journey.
Okay, I'm going to take him inside because it's a long night and we spent a long time with this. Now, what we probably want to do is go do some searching on this, which means we are going to brainstorm and I'm going to check my chat house. Just me tonight. Are my shows really that bad? Yes, they are sometimes. I'll admit it. Okay. Now, when I first started using this for walkthroughs, one of the things that they were blaming it on was illegal immigration. So the chemtrail thing is new. In those days, it was dirty immigrants with parasites. So I don't want that. I want it yellow. I'm going to get another one. We want to know what it is. What is it? And we want to know causes. Symptoms. And on the reverse side, we're going to want treatment. And we're going to want to know, and I'm changing colors again because it's a different subject. We're going to want to know history. I'm going to put this in the front because we care about it. And I'm going to move us a little to the side. We'll probably have to work down rather than to the right because I came back in backwards. But that's what we're going to be looking for. So what we're going to do is take this lovely thing all the way over to Medline for some good Medline-y goodness. Because I'm not looking for this on Wikipedia. And just to set everybody straight, because I'm going to say something harsh later if I'm allowed to. Just because it's in your mind doesn't mean it doesn't hurt. The feeling is real. The cause may not be what you think it is, but the feeling's still real, and a good, compassionate psychiatrist will tell you that. It's real. You're hurting. Pain's real. We can fix the pain. You're not a piece of garbage because you feel like there's something crawling under your skin. I will say something harsh later, but it still stands that you are not a piece of garbage, because that is what is happening to you. Now, let's get Google back up. We love you, Google. And that is an almost unreadable Earth Day. I don't know why they did that, but it looks awful. So let's go to GSU Library. And by now all of you know I love medical topics. We're going to push it over here. We want all that good Medline-y goodness, so we're going to scroll on down to the alphabet and click M. We want to use the Medline thesaurus. We're going to go down to Medline with full text. Okay. We're going to go to the mesh headings and type in Morgellons. We have Morgellons disease. We want this major. Now we can look at different things. We can look at the etiology. That's a fancy word for use with diseases for causative agents, including microorganism, includes environmental and social factors, personal habits, and lots of other things. Okay, history. We like that too. And we're going to want the psychology of it and the therapy of it. You're not a piece of garbage because you have there's a psychological issue. You're not crazy. Let's go. I'll be the last person to not tell you that. And we have 25 of these. They only go back to 2008. Okay. I'm going to pull this a little on the left to give everyone more room and get this guy over here. We are going to check the chat house again. I will be checking it periodically. Sometimes I get lost in what I'm doing. And here we have one, and one of the things you look at when you have one of these is the date. This is 2024. Review of the literature and clinical practice experience for the therapeutic management of Morgellons disease. If you are in the beginnings of writing a sophisticated biology paper, this is great. You can't use this article itself for the sophisticated biology paper, but for the English 1102 paper, hot stuff. It's 2024, it's 5 pages long. It looks like it's on my subject. Let's click find it and hope we don't go clunk. Can I hear a big loud clunk, everybody? Clunk. Let's look at the publisher website. Open link in new tab. We'll at least get the abstract, if nothing else. And this would be something that if you, I get a PDF. No, I don't. Access through my institution. Let's go through Open Athens. We hang in there, strap in. No luck. So, if you were a student, I was really writing a paper, I would get the interlibrary loan. This is current. This is current. It's got tons of references, and this would be a terrific place to start. And we begin. And notice the measured language. Morgellons disease is a rare and contentious health condition characterized by dermatologic symptoms including slow-healing skin lesions attributed to fibers emerging from under the skin. Contentious means they're fighting over it. To contend is to fight. And that's measured language. Patients also report sensations of crawling, biting, and infestation with inanimate objects. This review examines the etiology, and they're spelling it with an A, that means cause, patient characteristics, epidemiology, that's who gets it, historical context, correlation with Lyme disease, role of the internet, impact on quality of life, and treatment approaches for Morgellons. Despite the ongoing debate, MD is not recognized in medical classification, so our friend does not have to worry about this going on his record. It would just be a dermatological exam, psychiatric session, office visit to make sure that it looked decent for billing purposes. So, despite the ongoing debate, Morgellons disease is not officially recognized in medical classifications, with differing views on its causes. Some link Morgellons disease to Lyme disease, so it's questionable whether it's completely psychiatric, while others view it as a variation of delusional infestation, which means feeling like you're infested. The feeling's real. If I'm smelling smoke and think the apartment is burning down because they're smoking up the apartment next door and it's gotten through the walls, I smell it. I still worry. My worries and my smell are real. I go and check and turn the stove off. I check to see if the stove is turned on, and the stove is usually off. When I smell it the second time, I'm a little slower to go check. But the smell is real and the worry is real. So here the itching is real and the biting is real. The literature suggests both psychiatric and environmental factors may contribute. The manuscript explores the association with substance abuse, psychiatric comorbidities, infectious agents, and the role of internet communities in shaping perceptions. Morgellons disease's impact on quality of life is significant, yet often overlooked. Treatment approaches are varied due to limited evidence, with low-dose antipsychotics being considered effective, but patients' beliefs may influence adherence. A patient-centered, multidisciplinary approach is emphasized, considering both physical and psychological dimensions of Morgellons. Addressing controversies surrounding MD while focusing on patient well-being remains a critical challenge for healthcare professionals. In other words, don't treat the patients like they're pieces of garbage. They're not pieces of meat and they aren't pieces of garbage, even if they feel the itch, even if they think they're itching to death. Okay. And here we have the challenge of Morgellons disease, a patient with clinico-pathologic correlation. This is clinics and dermatology. Morgellons, and again, let's see how we do. We got one. It's fun to get one. And we get one. I hate when this does that. Okay. And they all think it's a rare condition. Morgellons disease is a rare condition characterized by patient-reported multicolor fibers and other non-organic particles or organic particles embedded in and protruding from different skin ulcerations. Although the scientific community is prone to believe that Morgellons is a psychiatric disorder, an infectious pathogenesis associated with Borrelia burgdorferi in the setting of Lyme disease has also been proposed. The histopathology is usually considered as nonspecific. To illustrate this condition, we present the case of an adult woman with significant ulcerative skin lesions. and critical changes on the face, trunk, and arms. And cicatrical changes on the face, trunk, and arms. This is where French is helpful. Cicatrice is scar in French. So cicatrical changes are scars on the face, trunk, and arms. After multiple biopsies and successful microscopic visualization of fibers, she received a diagnosis of Morgellons disease in the setting of delusional infestation. No evidence of Borrelia infection was found. Treatment with antipsychotics was initiated, but the patient was lost to follow-up, as is often the case with patients with Morgellons disease. And here we have it. We present the case of an adult woman with significant ulcerative skin lesions and cicatrical changes, which means scarring, who after multiple biopsies and successful fiber visualization under the microscope received a diagnosis of Morgellons disease. A 33-year-old woman was referred to the plastic surgery department due to recurrent skin lesions of unknown etiology. The condition had started 2 years prior to the referral, following a surgical excision of a breast fibroadenoma. I've got one of those, but I won't let them touch it with a 10-foot barge pole. Since then, numerous ulcers had appeared on her cheeks and trunk. She insisted that she had fiber-like materials corresponding to sutures under the skin that migrated from the mammary area to the trunk and face. She found fiber-like material. I'm sorry, guys. Is anybody here squeamish? There's nobody here but me, and I'm not. This is what she was doing to herself. Clinical presentation of Morgellons disease. A, a skin ulceration with straight edges and sharp angles, the triangular shape on the face. Note the adipose tissue protruding from the ulcer. Skin ulceration on the contralateral side of the face. So this woman had been scratching her face miserably. She excoriated the skin. In her medical history, there was an attempt at uxoricide by her female former partner. Whoa. No wonder this woman is messed up. Uxoricide is killing of a spouse or a girlfriend. Let me get the search up here. We'll get a definition really quickly. The killing of one's wife. Not good. So no wonder this woman had it rough. On clinical examinations, we observed some ulcerations with straight edges, sharp angles, and triangular shapes on the face. The trunk along with numerous scars. Previous skin biopsies had revealed only ulceration of the epidermis with nonspecific inflammatory infiltrate. Laboratory studies were remarkable only for the hypochromic microcytic anemia with a low hemoglobin content, 33, this is common, of 7.2 and 23% of hematocrit requiring a blood transfusion. Lyme serology was non-reactive. She underwent surgical debridement with an autograft to repair the ulcers. They were also repeatedly biopsied in different areas of the face, trunk, and arms. Histopathologic study in various sites revealed epithelial necrosis with ulceration, pseudoepitheliomatous hyperplasia on the lateral borders, edema, neovascularization, red blood cell extravasation, necrotic collagen fibrosis, and foreign body giant cells inflammatory reaction. Some grade of blue inorganic material with filamentous structure that exhibited white birefringence under polarized light was seen at the base of the ulcers embedded into the necrotic tissue and fibrin or surrounded by inflammatory infiltrate in the reticular dermis. And lots of stains were negative. In the days following surgery and the use of and occlusive dressing. There was rapid healing of the bandaged ulcers. However, there were new lesions on unbandaged and previously unaffected areas. She received a diagnosis of Morgellons disease, and self-induced facial dermatitis was made explicit, but denied by the patient. Facial dermatitis, as in facetious disorder, which means fake. It's an ugly word, but denied by the patient and her mother. Under pressure, she agreed to see a psychiatrist who confirmed a delusional disorder. Her therapeutic regimen included lozapram, haloperidol, sertraline, and a lot of stuff. But the patient requested a definitive surgery to remove her scars, which we refused. The patient asked to be released from the hospital and was lost to follow-up. We later learned she had requested a consultation at another hospital for the same problem. Because the biopsy specimens had been requested, Morgellons disease turned into Munchausen syndrome. If she'd have gone to the shrink, she wouldn't be accused of faking it. Munchausen syndrome is pretending that you're ill when you're not. And here we have another one. This is 2021. Morgellons disease, etiology and therapeutic approach, a systematic review. And here we have exploring the psychological profile of patients with delusional infestation. And here we have the first 5 investigative science-based evidence of Morgellons psychogenesis. And that one is 2016. I don't know which one I want. Let's try this and see if we get in. We hang in there, and we are in. We can cheer. This one's a little older, but it might be interesting. And again, Morgellons disease is characterized by patient reports of fibers embedded in and protruding from the skin. These used to be worms caused by immigrants, but now we've changed to chemtrails, obviously. Etiologies from infection to delusion have been endorsed. The treatment guidelines are not well defined. The objective of this manuscript is to evaluate the existing evidence regarding the etiology and treatment of Morgellons disease. In an effort to better inform clinical management, a PubMed search, including the keyword Morgellons, delusional parasitosis and fibers, delusions in parasitosis and fibers, or delusional infestation and fibers, was completed. Original publications directly assessing the etiology or treatment methods of Morgellons, published between January 2010 and the time of manuscript preparation, were reviewed and evaluated. 16 articles regarding etiology were reviewed. All studies were correlative in nature with various limitations. Support for psychiatric etiology was more widespread than support for an infectious etiology. 11 articles regarding treatment efficacy were reviewed. Antipsychotic regimens have the most evidence of efficacy. Existing data regarding Morgellons disease suggests a psychiatric etiology and supports treatment with a low-dose antipsychotic agent, and once non-psychiatric causes have been excluded. Okay. Yeah. I kind of knew this was here, but it's still kind of fun. And if you want to play around with this a bit more, I'm going to take us back out to the main library. Bink! Out we go. We can throw this in the library catalog. Sometimes these work out nicer. And here we have Chemtrails, HAARP, and the Full Spectrum Dominance of Planet Earth by Elena Freeland, who, by the way, was recently speaking on Cloud Hub. In fact, not on Cloud Hub, she was speaking right here. See the name, Elena Freeland? Somebody bought this book, and I don't know who bought it. I'm going to see who the hell bought it. Okay, this came, EBSCO stuck it in there, and we bought the package, and we get whatever gets put in the package. If this were my money, and I were buying books, or if I were library director and I caught somebody buying this, I'm not for censorship, but we've got a limited budget, and we have a limited budget, and we have only so much money, and you have to support courses as part of your mission. This doesn't do it. If I had an infinite amount of money, if somebody passed this in the gift pile, it could go on the shelf, no problem. But if we're going to pay for it, we only have so much money. We're going to not buy it. So it is not censorship, it's collection development and priorities. When you have limited funds, certain things get bought and certain things don't. And we can certainly get lots of books on the environmental effects of aviation and on stratospheric studies. This we would not do. Okay. Now this one is another one. This is 2014. It's okay if it's a little old. We're looking at an overview. Sometimes you have to kick it along. And yes, this one we have, it's the same database. Here it is. And if we go to the index, we can find our Morgellons. Slop at the top, slop on the side. Okay, we are looking for M. Morgellons. I'm looking through the index. This is your best friend, in case you didn't know. And I'm going to check our little house again. And again, I haven't been on all that much. So this is Morgellons disease, pages 220 to 223. Okay. 220. Morgellons debate. And again, this is written very nicely, and it is 10 years old. Proponents of Morgellons disease define it as an illness in which thread-like fibers, figure 26.1, under the skin cause crawling sensations and skin changes. Fatigue, pain, brain fog. The term is not widely accepted by the medical community, although Medline does have it as a subject heading, who mostly believe it is a form of delusional infestation or somatic symptom disorder. I like that second word a lot better, because when you say somebody is delusional, you're saying they're garbage. What they're thinking is not straight. In this chapter, we discuss the history and current debate of this highly controversial topic. In 1674, physician Sir Thomas Browne wrote about a disease affecting the children of the Languedoc area of France called the Morgellons, wherein they critically break out with harsh hairs on their backs, which delivers them from coughs and convulsions. In 2001, Mary Litato discovered the article by Browne when trying to find a medical explanation for the fibers growing underneath her 2-year-old son's skin, which she visualized using a microscope. The term Morgellons disease found its modern use when Litato established the Morgellons Research Foundation in 2002. Although some believe that Litato suffered from psychological disorder, others with similar stories believed there was finally a medical answer to their suffering. Morgellons disease is now a highly sensationalized topic. And it was when I was doing my walkthroughs. This is 2014, with much debate about whether or not it even exists. At the time of this publication, a Google search for Morgellons resulted in 694,000 hits, whereas a Google search for delusions of parasitosis received 44,000 hits. The Charles E. Holman Foundation runs an annual Morgellons meeting and hosts a busy website. So let's have a look at those right over here. I'm pulling this one in so we have it right next door because we like it right next door. Hello, we want you over here. Okay, so we have here, okay, this is www.cehf.org. Okay, let's try it. The CHEFHF the CEHF.org. Here we are. And they have a whole lot of stuff. And you can look at this. And there are additional Morgellons sites. There's somebody covered with white scars. And there's even a video. And there's my little boilie in my lap. Okay, and research and publications, we can open that up. And there are additional Morgellons sites, so lots of stuff here. I don't know where these are all coming from. But there's a lot of stuff here, mostly about the Lyme disease connection. And here we have Oklahoma State. Oh, there's an Oklahoma State Center for Health Sciences, Morgellons disease. Well, that didn't help. That's strange. Let's look up. Okay. This is from University Center for Health Sciences. Oklahoma State's University Center for Health Sciences. They probably have changed URLs. Okay, that's a whole different website. Now we can search for Morgellons. See, if you went to, if you were in, I think it's Tulsa. I don't know where this place is. They should say where they are somewhere. Okay. So if you were in Tulsa and if you were in Tulsa, you could definitely, you probably would have a doctor that might know about Morgellons. Okay. A lot of Lyme disease stuff. Rare Disease Network, and a lot more about Lyme here, so I'm not really thrilled. And here we have a Morgellons disease diary where we're waiting for Oklahoma to do something. And this is somebody talking about how they do that. And there is a Morgellons.org even. There is a website. Morgellons Research Foundation. I believe we started with that back. Where were we? We were way back here. Lateo, who started the Morgellons Research Foundation. Looky what we got. This is still in business. Now, somebody did, the website, somebody did not do a good job coding this because it never should have been this tiny. Oh, wow, now they're all into chemtrails. Now, we know, we've done a chemtrail one. They're contrails, and they're mostly carbon dioxide. There's a little bit of particulate in them. They're not the most wholesome thing on the planet, but Uh, a lot of this is here. And here we have revelations from a man who helped design Morgellons disease. Who would design a disease? I think we are going down the rabbit hole big time. These two videos are well done and researched by Clifford Camacorn and Dr. Gwen Scott. The information in these videos affects every individual in this country. They are perhaps the two of the most important videos ever made. If you have not viewed them, you need to do it ASAP. Not just a few people with a weird disease called Morgellons, but all of us. This information personally affects your loved ones and even people down the street that you don't care about. Why? We may all have Morgellons disease and it is man-made. Do I really want to see this? Let's hope it's still there. It's there. Ooh. Lovely. Clunk, clunk. And this is the transcript. Okay, many people viewing these videos may have overlooked one of the most important pieces of information that was included in each. Someone has confessed to participation in at least one aspect of the formulation of this disease. It is not to be overlooked or tossed aside. I do believe that Dr. Gwen Scott has been contacted by a credible source who has admitted his part in creating Morgellons disease. There is still so much conjecture to the origin of Morgellons that perhaps Gwen's statements will impact someone who is still pretending that the disease is not a deliberate assault on all humankind. If I wanted to assault all humankind, I wouldn't leave them just itching. And it isn't just itching. Itching sucks. Big time. I have eczema. Itching stinks. And here we have it. And I'm not going to read all of this. But this is going way down the rabbit hole. But this does exist, and people are... What happened to this? They're not having a good time tonight. Hey, they do know about it. Let's have a look. We're coming back onto the surface again, if you're curious. I mean, this was going on for a very long time, and it used to, again, be something they linked with illegal immigrants. This is a little different. This is the Department of Pharmacology and Physiology. The Department of Pharmacology and Physiology is dedicated to teaching and research as well as service and outreach for OSU and the community. Faculty research interests included acetylcholine pharmacology, depression and eating disorders, pain and substance abuse, estrogens in the central nervous system, Morgellons disease, neuroinflammation, neurosciences, opioid pharmacology, and addiction. And I don't know which of these is interested in the Morgellons, but we can find out. I'm going to open that up and have a look. And here's another one. So this is faculty research interest. And who does Morgellons? Randy Seymour, research profile. Morgellons disease role, channels in the heart, nervous system, and cancer. And we can look at their research profile, and this is your guy. He's even wearing an okay tie. Now, maybe they made him do it for the picture. It's a good headshot. We have somebody at Perimeter who used to do all the headshots. I have a professional headshot for that reason. And you can see what he works on. Cultural competence. And he should have Morgellons in here somewhere. Molecular analysis and systemic dermatosis of Morgellons disease. So people do take it seriously. Improving interprofessional practice and cultural competence. I think that means not treating people like garbage. Morgellons, a tiny bug or a big delusion. So he's written about it very obviously. I'm taking you back one because there was another one here. Okay, there's one. There's one here. But if you go over here, this will come up at Carlart Publishing. And it's a psychiatry podcast. And this is 2002. So it's not uncommon. Thank you for watching. And remember, you can catch me live on Twitch.